Thank you for joining us for this special series of This is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., PhD, in collaboration with the George Washington University's Center for Aging, Health, and Humanities. So welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about some policy lessons learned from COVID. And today I'm joined by Lieke van Heumen, as well as Samantha Kohler. So welcome, ladies. How are you today?
Good. Thank you for having us, Melissa.
Yeah, thank you.
Great. So maybe we'll start with some brief introductions. So I'll let Lieke go first, and then we'll hear from Samantha.
That sounds great. So my name is Lieke van Heumen. I'm a clinical assistant professor in the Department of Disability and Human Development at the University of Illinois at Chicago. And this year I was a Health and Aging Policy Fellow, placed in the office of Senator Casey in the Aging Committee.
And Samantha?
Great. Hi, I'm Samantha Kohler. I'm a senior policy aide on the Senate Special Committee on Aging under Senator Bob Casey, and Lieke was my fellow this year. And together we worked on issues related to aging direct services. So really any of the programs that fall under Older Americans Act or area agencies on aging, and also a little bit related to health and access and affordability for healthcare.
Great. Well, it's good to see you again, Samantha, because you and I actually met during my fellowship, and I can remember sharing a cab ride coming back from a briefing or some other adventure, some other adventure we had pre-COVID. So today we're going to be talking about some of the challenges that the Aging Services Network has faced, particularly around social isolation and nutrition. So maybe before we get started, maybe explain what that term Aging Services Network means.
Sure, yeah. So we understand that to be the agencies and programs and activities that are supported by the Older Americans Act and that help older adults who live in the community be healthy and have the social engagement that they need.
Okay, and so I think the term that I typically think of is just that the area agencies on aging, but they are called sometimes slightly different things in different states.
And I think that it depends, like you said, Melissa, it depends on the state. Some states only have a state unit on aging and they don't have area agencies on aging. Other states like Pennsylvania have 52 area agencies on aging, and we have quite a few that cover our 67 counties. But it can also include some of the organizations that our AAAs contract with, and depending on how a state or how a community has their aging network set up, they could contract with many different organizations on the ground to implement some of the services that seniors and people with disabilities receive.
Great, and I know here in Fairfax County, even their website is just a great kind of repository of resources. So even if your county doesn't have an area agency on aging, I think just looking at the different websites can give you an idea of some of the services that may or may not be available in your area. And so, they do provide a really important kind of safety net for older adults that are in the community. So and they were already kind of facing their own challenges, but what has happened with COVID? What type of additional challenges has COVID brought?
So at the start of the pandemic, along with the rest of the country, seniors were also asked to stay at home and protect themselves and others from the virus. And early on, there was some concern about what this would mean for seniors. So thinking about how do they get the same access to nutrition, home and community-based services, and how are they going to be protected from social isolation without being able to leave their homes? So this spring, Senator Casey held a series of roundtables with 51 of the area agencies on aging in Pennsylvania to really hear directly from the directors of the AAAs, as we like to call them, what their issues were, what their concerns about making sure that they could continue to serve seniors and also protect them during the pandemic. So we learned a lot from hearing about the creative approaches that they were taking. And then in September, Senator Casey also spoke with the Pennsylvania Council on Aging, which is an organization of older adults across Pennsylvania, designated to inform the Pennsylvania Department on Aging on issues that impact them. So there was a number of different challenges that were discussed during these conversations that were really insightful. So one big bucket of this related to the concerns in nursing homes and the lack of sufficient testing, lack of PPE, a lack of sufficient staffing, some concerns about ombudsmen not being able to access and reach seniors in congregate settings, and also a lack of technology for nursing home residents to stay in touch with their family members and their loved ones. So in addition to concerns about nursing homes, we also talked about home and community-based services. And we saw that some seniors canceled their services because they were afraid of being exposed to the virus. And we really need long-term support for home and community-based services, as we see challenges with having enough workers in this field, and supplying them with PPE is obviously also been a concern. Some of the other topics that were brought up in these series of conversations were requesting some funding flexibility for Older Americans Act programs. So having some flexibility in how they could distribute their funds based on their specific needs in their county. So looking at nutrition or caregiver supports. Additionally, the area agencies on aging shared some concern about an uptick in scams targeting seniors. And I think that many of us have experienced receiving more robocalls, and this is something that there's concern about with seniors specifically. So some of the area agencies on aging included educational leaflets in home delivered meals with information about this. They also collaborated with local news outlets to share information. So it was really good to hear about those initiatives. Additionally, and this just demonstrates how many different issues there are and how much work there is to do in this area. So some concerns about timely enrollment in Medicare because of the closure of some of the Social Security offices, delays in receiving care due to the stay-at-home orders. And then one other issue relates to lack of access to technology and broadband. So when some of the connections that we all made moved online and remote and virtual, seniors that don't have that access are basically cut off from having the opportunity to engage in that way. Then finally, we had some ongoing conversations with the area agencies on aging, who sometimes have direct senior centers, or they help fund senior centers. So with many of these closing in the beginning of the pandemic, some have reopened, some have not yet reopened, but there is a number of logistical and other safety concerns with how to reopen these centers and what the precautions have to be taken. So that's been part of the conversation. And then issues around mental health concerns in seniors, again, related to the increased loneliness and social isolation and anxiety around fears with the virus is something that was discussed a lot. And then finally, nutrition related issues. And we saw that there were many more older adults who requested home delivered meals than before the pandemic, and the Aging Services Network really having to rise to meet that need and to meet that challenge. So it's a widespread of issues to consider.
Yes, quite a bit. So there were several things in there. Thinking about the podcast we did about COVID and scams for older adults, and then the nutritional issues. Nursing homes are near and dear to my heart. In fact, I was talking to my mom this morning because, you know, CMS finally did, like the middle of September, allow family visitation outdoors. And, you know, it was a big issue with my grandmother not being able to touch my mom. And I was like, why could they not, like, if we go to get our nails done, we can sit in front of someone and touch each other's hands. I was like, they need to create little stalls like that so that at least caregivers could get close to each other and touch each other. So trying to figure out, or how do you put all these creative solutions together so that we can share kind of best practices. So with nutrition and social isolation, what are some of the things that COVID has really amplified within the aging services network?
Yeah, related to nutrition specifically, I think even prior to COVID, seniors have really long relied on this patchwork of federally funded nutrition programs to meet their needs. And yet, food security has long persisted, even with this patchwork of programs that are administered out of both the Administration for Community Living and out of U.S. Department of Agriculture. And really, as evidenced by the COVID pandemic, even small changes in access to or the availability of nutritious meals can really put the health and well-being of seniors and older adults generally in jeopardy. And millions of seniors across the country are served each year by senior nutrition programs, particularly the home delivered meal program, or I think what many of us know as the Meals on Wheels program, and also the congregate meal program, which many people know as lunches at senior centers. And both of those programs are authorized by the Older Americans Act. But also many seniors are served by the Supplemental Nutrition Assistance Program, or also SNAP, the Commodity Supplemental Food Program, the Senior Food Box Program. And these are all programs that are authorized under the Farm Bill and administered by the U.S. Department of Agriculture, like I had mentioned before. And in March, when COVID hit, and as Lieke mentioned before, seniors began to stay at home due to the pandemic, either because of stay-at-home orders or honestly because of fear of becoming infected and becoming ill. We saw a boom in older Americans requiring nutrition assistance. And what we really heard from those conversations with our area agencies on aging was just this huge uptick in the need for nutrition services by seniors, and really also a need in increased funding to serve seniors. And as part of both the Families First and the CARES Acts, which were passed in March, Senator Casey really championed over $1 billion in funding for programs authorized under the Older Americans Act. And his request for that funding was informed by those conversations he had with our area agencies on aging. And included in that was a significant increase in funding for home delivered meals and congregate meal programs. And as AAA saw and continue to see really an influx in the need of nutritious foods for seniors, that money can go towards serving seniors through those programs. But most importantly, that legislation also included some flexibility for area agencies on aging when designating an individual as eligible for home delivered meals. There was some concern that we had heard from area agencies on aging, whether or not a senior that was normally physically coming to a senior center and having congregate meal, for example, would then be eligible for a home delivered meal, because technically that person wasn't homebound by a homebound definition. And so there was some concern as to whether AAAs would be able to translate the people who had typically been receiving congregate meals into receiving home delivered meals. And so that legislation also included some flexibility in the definition of who would be considered homebound, so we could ensure that seniors who were normally going to a senior center to receive a home deliver or to receive a congregate meal, but were now staying at home out of fear of contracting the virus, would still be eligible for home delivered meals during the pandemic. So that's one example, thinking about Older Americans Act programs. Senator Casey has also been thinking quite a bit about the Supplemental Nutrition Assistance Program, or SNAP. When the pandemic started, we began hearing from quite a few older Pennsylvanians who are SNAP recipients that although they had SNAP benefits, because they were unable to leave their home to physically go to the store, mostly out of fear, that they weren't able to use their SNAP benefits. And seniors that can't safely leave their home may rely on grocery delivery, yet like many of us did during the initial phases of the pandemic, yet for low income seniors that utilize SNAP, there were really limited options for their ability to utilize SNAP as part of grocery delivery. And so we were hearing from seniors that I have SNAP benefits, but I'm not able to use them. I'm concerned about my access to food in general during the pandemic, and people that were really in tough situations. So throughout the summer months of the pandemic, there was an expansion of the SNAP online purchasing program, and Senator Casey had really been pushing for that. And that would allow some individuals to receive delivery of groceries using their SNAP card. But really there are additional barriers that remain, and Senator Casey has been continuing to call on USDA to increase accessibility of SNAP delivery, to include additional retailers and purchasing options, so there aren't just a limited options related to which retailers that individuals can use that are on SNAP. So while we're really trying to, and he is really trying to take this expansive approach to combating the issue of senior nutrition and access to nutritious foods, working to ensure that all seniors have access to nutritious foods, we've clearly gone a long way in the past 7 months, but really have a ways to go still, and making sure that as the pandemic unfortunately continues, seniors continue to have access, and that AAAs and the SNAP program can continue to serve them.
Yeah, I mean, I hadn't really thought about that. And then the other side of that is, what if, I mean, most of the online grocery order is online. So if you don't have broadband access, like Lieke mentioned, you know, I don't really know of many places you can order your groceries by phone. You know, so that's an issue I had not really thought about. And then having the ability to pivot during, you know, an emergency such as this. And this is the first time we've ever had to live through a pandemic. I don't think it's the last time. So
yeah, I mean, I think you're right, what you're saying though, that what we're seeing from the network is this, you know, excellent ability to pivot. I think the network has always had that, and they've always been responsive to the issues that they're seeing in their community, and just how widespread the impact the pandemic is having on seniors across the country. We're now at a policy level really having our eyes wide open to the fact that our AAAs have always been there, have always been doing this work, and that they're masterful pivoters in times of need. I think a good example of that is something that we saw out of southeastern Pennsylvania. We had an area agency on aging that partnered with a local transit authority. You know, as you know, shared rides were really down in the early months of the pandemic. People weren't leaving their house to go to medical care, as Lieke mentioned before, and weren't really taking trips to the senior center and other things that shared ride would be used for. And so that one of our area agencies on aging partnered with our local shared ride provider. And for these drivers of shared ride that would have otherwise been furloughed, they paid them to go do grocery shopping for the seniors. So the seniors would place their order, and then the grocery store would get the order together, and then the shared ride driver would go pick it up and deliver it to the senior and be reimbursed for the cost of the groceries. And then the area agency on aging, I believe, was covering the cost of the delivery that the organization would have otherwise charged. So it's kind of this partnership between the grocery stores in that local community, the shared ride providers, and the area agency on aging.
right, and I think that's a really creative and innovative you know, solution, you know, to that type of problem.
I think it's one really great example of how creative the aging network got. And as I mentioned earlier, providing information to seniors and coming up with ways to rethink the way that they are delivering services. And I think that one sort of key takeaway message for us has also been hearing from the area agencies on aging that they feel much more prepared to deal with the challenges that the pandemic has brought over time. And if there are new lockdowns or other restrictions, that they can use the experiences that they have gained this year to continue to reach seniors. And that's going to be very important in future.
Right, and the importance of paper-based communication. I mean, just like using the Meals on Wheels program to deliver paper-based news and information and warnings about scams, you know, there is this huge digital divide between, you know, not all older adults are the same, and they don't all have access to the same resources like broadband, cell phones, smartphones. So having multiple dissemination methods is important too.
And even though there's big differences in different states and different areas of states, with some parts being very rural, others more urban. The situation and how to best serve seniors is going to look a little differently. Nevertheless, it's really important that these experiences are exchanged among the Aging Services Network. And that's why Senator Casey sent a letter to Assistant Secretary Lance Robertson of the Administration on Community Living to ask them to share some of these innovative approaches.
Right. And I think I agree. I mean, and that's probably the best place to begin to put some of those best practices, because that's been on my mind too. It's like there are variations, but how do people learn from each other in a rapid way? So maybe, Lieke, you could expand a little bit more about some of the issues related to social isolation for older adults.
Absolutely. And obviously with the pandemic, that has become a much bigger concern. Social isolation and loneliness is something that is experienced in very high rates in the older population. And the circumstances this year has only increased that, both with seniors who live at home and those in nursing homes who have not been able to see their family members for months on end and being very isolated. So this causes a lot of concern for mental health and physical health, and probably will have a long-term impact. So we have to really think about what are some of the ways that we can approach this. And just as area agencies on aging are using technology to the extent they're able to offer some virtual or remote programming, nursing home residents need access to technology to be able to speak to their loved ones. But we see that there is across the board a lack of access to both broadband and technology to access the internet, as well as training that comes along with that. So when people do not have access to those, that decreases their opportunity. So Senator Casey this year co-sponsored the Access Act with Senator Klobuchar. And the purpose of this act is to facilitate virtual visits for those who live in nursing homes and to provide technical assistance so that nursing homes can use telehealth. And this is a bipartisan act and would make a small dent into a lot of work that needs to be done in that area. This fall, Senator Casey also published a report, a blueprint on creating health and economic security for older adults. And this report explores how the pandemic has impacted seniors in different areas of life. And social isolation is one of the major highlights of the report. And preventing social isolation and all the impacts of that on seniors. So some avenues to explore are, again, giving area agencies on aging and senior centers the tools and the funding that they need to implement virtual programming and support seniors to participate in that. Expanding internet access and increasing access to phones and tablets, which again, part of that can be accomplished through the Access Act. Strengthening access to cellular phone service is important as well. And then support lines can have a role in this. So these are some of the different approaches that can be taken through policy to help alleviate the issue of social isolation.
So yeah, so one of the podcasts that we did was a program called Well Connected, and having, access not only through the internet to like educational programming, support groups, and like virtual museum tours, virtual natural park tours. But if you didn't have access to the internet, you could still register for this program, and it's free to anyone over 60. And they would send you a book of the pictures, and then you could call in with your landline and still look through the pictures and be part of that virtual tour. So I think it's just being creative about how do we help people that have different levels? How do we help them to become more connected?
again, it's interesting that you mentioned that, because it's a matter of taking away some of those barriers, right, and providing accessibility, and that's really important. And people will have different needs, so how can we come up with ways to meet those needs?
And speaking of coming up with ways, so now that we've talked about social isolation and nutrition, they were major issues for older adults prior to the pandemic. They're going to continue to be problematic after. So what policy solutions do you think are going to be required to alleviate either or both? And I'll pose this question to both of you, and either of one of you can answer, or both if you can.
I think that, we talked about in depth 2 issues that seniors are facing during this pandemic: access to nutritious foods and social isolation. Of course, Lieke outlined a plethora of other issues that seniors are facing, that things that our area agencies on aging address, things that our healthcare system can address. There's obviously issues related to seniors creating and keeping economic security during this pandemic, issues related to job loss. I think the number one thing that we can see is another COVID package passed, and that should include funding for our aging network and its specific attention to the issues that are facing seniors and people with disabilities during this pandemic. Of course, we couldn't go into detail into all of these different issues and just focused on nutrition and social isolation, but 7 months into this, we continue to hear from seniors in Pennsylvania and from our aging network in Pennsylvania that these issues persist. And while they certainly are grateful for the funding and the flexibility that they've received so far, that this is just a step in the right direction and that we can't go backwards. We need to continue going forwards and continue supporting the aging network, because they are in need and seniors are in need.
So I have a quick question, because sometimes the federal government has a role in things, but there are also things that organizations and individuals can do. So if I were a business owner or a philanthropist that wanted to make a donation, or if I wanted to volunteer, like are those some of the ways that like people in different states and locally can do?
Yes, certainly. I think the best thing that people can do is wherever they live, wherever their local community is to reach out to their local area agency on aging, their local center for independent living, their local Meals on Wheels. Really, I think Google is your best help, or any type of internet search, or just calling the local organization that serves seniors, and they can point you in the right direction of how you can help out. I know early in the pandemic, we were hearing from a lot of organizations, including our area agencies on aging. They were actually really concerned that they would see a big drop off in volunteerism, especially because many of their volunteers tend to be older adults themselves. And what we really overwhelmingly heard was that they saw an influx in volunteers, particularly from younger individuals, like college-age students that were home and not able to physically be on their college campuses. And it doesn't hurt to continue reaching out. And I imagine that the volunteer situation changes day by day in a community, and that if you're a local business and you want to donate, or if you're an individual and want to volunteer, just giving a call to your local organization that serves seniors is the best thing that you could be doing.
And I think we're all concerned about keeping ourselves safe in this time. It's just good to realize that there are ways of volunteering without leaving your home. I think many seniors appreciate having someone to talk to, receiving a phone call, and all of us do, really. So in creating some of that engagement can be done from home and be very valuable.
I think that's a great example, Lieke. We were hearing from a lot of our senior centers that quite a few of them created phone trees, or the senior center director, instead of managing the functions of an open senior center, was helping figure out the home delivered meals that were coming out of their center. But oftentimes they were also doing a lot of phone calls to the participants that would regularly come to their program. I volunteer with an organization that reaches out to seniors, LGBT seniors, and I'm partnered with a senior, and we have a phone call every week. And It only takes a half an hour of my time once a week, but she's told me that those calls mean the world to her. And it's just so I can do that from the comfort of my own living room. I don't have to leave my house to volunteer.
So Lieke, maybe you can tell us a little bit about how you made the decision to serve on the Special Committee for Aging in Senator Casey's office. And then Samantha, you can give us a little bit of information about what it's like to have a fellow.
That sounds great, Melissa. So with my background working in clinical services as a psychologist and then more in research, I really felt that I was lacking the policy experience. So how do I make an impact on the lives of people with disabilities and older adults through policy? How do you go about that? And I did not have the exposure or experience. So once I started the fellowship program, figuring out where a good placement would be, options for the health and aging policy fellows are really broad. So working in the executive branch, working for NGO or an advocacy organization, or working in the legislative branch. And after our orientations and thinking about what kind of experience I was hoping to get out of this year, I really felt that a placement in Congress would serve me well. And what I really love about the Aging Committee is the specific focus on aging and disability policy. And I have more of a background in disability policy than in aging policy. So working with Samantha this year, getting the experience in, what is the Aging Services Network? How is this organized? How do area agencies on aging serve older adults? Through which means? What are the challenges? That has really provided me a lot more context. And as my work generally speaking, I'm trying to integrate aging and disability concerns. It's very helpful for me to have insight in sort of both buckets and how they overlap and where they overlap. And I've really been able to get that experience this year from working with Samantha, in addition to all the skill building that has been part of that experience. And I believe moving forward, having that insight and that new experience will really make my work more effective, whether that's going to be in the role that I have currently or a different role that maybe more direct policy work in the future. That remains to be seen, but it's really grounded me and sort of opened a new world, so to speak.
And it does. And so Samantha, tell us a little bit about your experience working with fellows, which, by the way, I want to thank you in advance for all of your awesome work with the Health and Aging Policy Fellows Program over the past couple of years.
Yeah, I've loved having fellows, and I think that my desire to have fellows and our committee has also had quite a few interns since Senator Casey became ranking member of the committee, and that really stems from my background. I have a background in direct practice social work, and to finish your social work degree, you have to do quite a few internships or shadowing of other social workers just to finish the program. And I recognize that I couldn't have gotten to where I am at in my career today, whether it be the direct practice social work that I did, or even here on the Hill working for Senator Casey for 3.5 years now. I couldn't have gotten to where I am today without other individuals in both direct practice and on the Hill mentoring me and helping me learn the skills that I needed to be where I'm at in my career. And it just felt really natural to me that the committee should and would take on fellows and interns and other individuals. It just feels really important. And of course, there aren't enough people in the aging network generally. There aren't enough of us that are interested in aging policy and that are experts in aging policy. So the thought that I could be involved in helping to train the next generation of individuals that are interested in aging policy was really exciting. And I think also most importantly is many of the individuals that the Health and Aging Policy Fellowship brings on are researchers. And one of the main questions we tend to get from fellows is kind of that translation. How does policy dictate practice, and where does research come in, and kind of this triangle of policy, practice, and research, and how those things inform each other. And I think it's really important that researchers know how to speak policy, because I don't think that policy professionals always speak research. And so the more researchers that can translate their research into short, easy to consume pieces of information for policy professionals is just the more likelihood that their research will be consumed by us. And I think that by having Lieke as a fellow and the other fellows that we've had on the committee, just spreading the word of how to better communicate with policy, with individuals in the policy sphere is just so important. And I imagine that as Lieke leaves the fellowship in the coming months and returns to full-time to her day job, that she'll be talking with her colleagues and other researchers about her time on the committee and helping them learn how they can make their research more consumable. And it's just, I've really, truly loved having her as part of the committee for the past 10 months now, and it'll be very strange to not have her here anymore, but I know that it's not the end of our relationship, and really honored that she chose the committee to spend her time with this year.
Well, thank you, Samantha. And I'm just really grateful for all the mentorship that I have received from you. And I agree, it will be kind of strange. Like, what's Samantha up to today when back to only my day job? But yeah, you brought in such good points, and that communication is so important. And everything that I do, how I talk to my students, to colleagues, how I think about my research, all of that is not going to be the same, moving forward from this fellowship program.
All right. Well, thank you, ladies, for joining me today, and I wish you both the very best. Thank you so much. Thank you for joining us for this special series of This is Getting Old. Sponsored by the Health and Aging Policy Fellows Program, Capstone Conversations is brought to you by Melissa B., PhD, in collaboration with the George Washington University's Center for Aging, Health, and Humanities. Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel, and if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.